Now I will be demonstrating how to draw up 2 insulins into a syringe and how to give a SubQ injection. So as always, I will start by reviewing the order for accuracy, like the patient's name, the medication, the time, dosage, route, expiration date, and all the basic rights of medications. I've got my 100-unit syringe. You always use the orange cap for insulin because it's in units. You do not use it for anything else, and you always use the orange syringe. So I would then make sure my patient doesn't have any allergies before I administer the medication. So I've got my R and my N. I would compare the order with the medications that I have with the basic rights, again, dosage, route, time, patient, medication, expiration date, all that. So I've got my medications. I would typically calculate the correct drug dosage, but for this case, we're just gonna use 7 units of R and 12 units of N. So I've got my antiseptic wipe. I'm going to clean the tops of the vials. And I'm going to let them air dry. I'm not going to fan them or blow on them. You want them to air dry. So I've got my 100-unit syringe here. And you want to start by injecting air into the N. So we're gonna get 12 units of air into the syringe. We're gonna inject the air into the N. Pull it out without drawing any medication. Now I'm going to put 7 units of air into the R. And this time I will invert the vial to draw up the medications. All right, now that I have 7 units of R, I will inject back into the N where I will draw up 12 units. 7 plus 12 is 19. So I'm going to draw up until I get to 19 units. I'm going to recap, and I've got my 19 units of insulin. I would just double check my medication and my dosage once again, and that is how you draw up 2 insulins into a syringe. Now I'm going to demonstrate how to inject the medication. So I would start by cleaning the injection site. When you give a SubQ injection, you always use between a 1/2 inch and 1 inch syringe with a 1/2 inch to a 5/8 inch needle with a 26 to 30 needle gauge. So that would be what you would need to use for a SubQ. So now that this has dried, I'm going to remove the cap. All right. When you bunch up the skin, if you have less than 2 inches of bunched skin, you're going to do it at a 45-degree angle. And if you have more than 2 inches of skin, you're going to do it at a 90-degree angle. So as you've got the skin bunched, you've got your syringe. You're going to keep it between your thumb and your other fingers with your dominant hand, and you've got your non-dominant hand bunching the skin. When you give an injection, you're going to dart it. So in this case, I'm going to dart it at a 90-degree angle. And as you inject the medicine, you're going to slowly release the skin. Let it sit there for a second. Make sure you've got it. And as you release it, you're going to pull it out at the same time. Don't do what I did. You would need to move your hand behind your back before you pull it out to make sure that you don't accidentally get your hand. So now that I've got my needle out, I would typically activate the needle guard and discard it in the sharps container, but in this case I'm going to recap it, and I would again dispose of the needle and perform hand hygiene, and that's how you give a SubQ injection. Alright, for subcutaneous injections, there are 5 sites that you can use. The first one is going to be your abdominal area. It starts beneath the costal margin, so underneath your ribs, and above the iliac crest, which is the top of your hip. So it's going to be this area here. You want it to be at least 2 inches away from the belly button. So this is the first site. And then you've got the outer posterior area of the upper arm. You've got the scapular area of the upper back. And then you've got the upper buttocks, about right there. And then you've got the anterior areas of the thigh.